morning, Senior Pride here. Yesterday I mentioned that at some point I would discuss depression in older people. And today is that day. Now, first of all, I think many of us remember a time when people just called it the blues and didn't really confront the fact that this was actually a disease, just like heart disease, just like spinal disease, just like any disease, just like diabetes. In fact, if you have diabetes, you're at greater risk of depression. There are a number of things that happen and will hint at, let you know that, yeah, you might be experiencing depression, and there are a number of things you can do. First of all, I'm also directing this not just towards older people, but towards people who are caregivers for older people, or who love an older person, or who support an older person, because sometimes the person is so impacted by the depression that they don't realize what's going on, and you as a caregiver or support may. Now, one of the obvious signs obviously is affect. So your mood goes down, you feel like everything looks kind of gray, that proverbial gray, everything doesn't seem right. That's a big sign. But there are other things. Your sleep is impacted. Your eating can be impacted, and that can be either way. You can be eating to deal with the emotion or just to suppress the emotion, or you may not feel like eating at all. Your liquid intake is also impacted. You may be not drinking when you need to drink, not taking in that water, or you may be kind of coping by living on caffeine, because it gives you that quick feeling of, I'm a little more awake here, I'm a little more aware. It certainly does impact sleep. Your sleep, you may be sleeping 12, 13, 14, 16 hours a day, or you may not be able to sleep. You may just not be able to sleep. It impacts pain. If you have something that causes pain, this could dramatically increase it. You'll find that your pain goes up and down at different times. You'll find that your pain is persistent and far worse than it was. So it can impact a lot of bodily systems. It can impact your motivation, your desire, and this is a big one, your motivation or desire to do things, to just accomplish tasks that you used to take for granted. These are some of them, but there are so many more things that occur with depression. It basically takes over and controls your systems. And it is I know people want to think that it's just the blues and it'll go away on its own. You really do need to take control. Now, I know probably everybody listening to this has heard of antidepressants. They can be useful. If a doctor recommends a tricyclic, push them in another direction. Tricyclics have long-term impact that is very severe, and they're high on that list of medications that can cause dementia. Other medications for depression, and there are quite a few of them, so I'm not going to go through them all, but they can lead to the same kinds of issues, dementia, but they're not quite as impactful as the tricyclics. Now, the thing to know about antidepressants is that they impact several hormones in the brain, or several chemicals in the brain, and one of them is serotonin. They also impact the receptors, because what they're doing is they're stopping or starting certain chemicals from being received or not received in the brain. Again, we know that these things ultimately can result in issues like dementia. So when you're talking to the doctor for yourself or for a loved one or someone you care about, try to communicate that what you might be concerned about, if there's a family history of dementia, if the person's already showing signs of cognitive decline, and depression is quite common for dementia patients. So ask for information on the different medications. Look it up yourself. Please look it up yourself. Ask for lowest possible doses. We know that as people get older, their bodies do well with lower doses and don't do so well with higher doses. We need lower doses as we get older. So really really refuse to be started at a mega dose, and demand that, and go in with the information already. Research it. Go in and say, this is what we're looking at, this is what we want. This is not depression, but when I decided that yes, a medication for neuropathy would be potential aid, I did the research before the doctor heard from me. So I was the one who said, this is what I want. I know what these are the side effects. I want a very low dose. This is the dose I'm okay with. I basically told the doctor what I wanted, because that gave me control over medication. In my case, gabapentin, which is a completely different medication, but it is one that has the potential to cause dementia, and all the others are even worse. So gabapentin was my choice. But again, when you're going in, make sure you've got the information under your belt. If you decide that you don't want medication, or you also want to increase your chances of overcoming the depression, there are many things you can do in your environment. One is simply a healthy diet. Try to kind of turn the eating habits around. I know it's hard when you're depressed, but it's very important to focus on things like eating 3 meals a day, trying to eat healthier foods, so lots of protein, not eating things like seed oils that tend to affect the body and brain, and they're very well known to cause cancers, which isn't going to help. Just a healthier diet, and there's nothing wrong with having a treat once in a while, but just make sure the diet is focused. The other thing, and this is a biggie, is physical movement. People who are sedentary don't fare as well, and they're more likely to develop depression. Simply getting up and moving, taking a walk a few times a week, will start to get the motor going, as it were. You will increase your body's health and agility. You will start to feel better. Everything kind of gets better. The exercise really does affect the brain. Now, B12, very important for affect. So if you're taking a multivitamin already, try to get one that has a complete B complex, and check out the B12. Make sure you're taking that. Also, vitamin D. If you live like me in a place that doesn't get a lot of sunlight for a good chunk of the year, it's okay to take a supplement. You know, when you're taking calcium, you kind of have to take vitamin D because it's important for the digestion of the calcium. But in this case, your big focus wants to be on that vitamin D. There are other things you can do. Try to, if you're not feeling very social, and that frequently happens with depression, try to get a little more out there. Try to work with people. Try to, even if it's just on the phone at first, just try to get out there and interact with people. You'll find that it really does brighten your mood. The other things I can think of is try to set a schedule. If you're getting more sleep, you'll do better. For some people, they need something for sleep. Now, I have to tell you, the pharmaceuticals for sleep are very problematic. They may help for a short time, but they will need to be increased. They are very high on that list of things that cause dementia. But you can do other things. You can take valerian root. You can take blanking on it, but there's something that's very common that people take. The point is, try to find a natural means and keep a schedule. If napping during the day seems to be impacting you, and more than likely it will, stop napping. Start sleeping through, and the same time into bed every night, the same time out of bed every morning. Try to get back on that schedule. It is very difficult for people who have sleep disorders. I can personally attest to this. This had nothing to do with depression, but everything to do with the fact that I'm just not a good sleeper. That schedule, no naps, physical exercise during the day, all of that will help to get that on track. And sleep is very important for affect. And in there, I say goodbye and good luck.